welcome you all to the Fulgenetti Center for Bioethics and Humanities and a new program which is called Cultural Influences on Bioethics and Health. And we're doing a lecture series over the coming year on a big question, what is life? And how do conceptions of life influence the ways we think about medicine, about tradition, the ways in which religious and faith traditions have interpreted these questions. This is a new program for us, so we'll be very interested in your feedback and thoughts as we move along. And we're going to be starting today with, sorry, I had on here that you should all know this program is funded by a generous gift from Dr. Helen Morris. Thank you, Helen, wherever you may be. If she shows up again, we will thank her. Today, we're honored to welcome Dr. Bruce Feldstein, who is a physician, chaplain, educator, and a reflective practitioner at Stanford University School of Medicine. Dr. Feldstein brings a rare and deeply human combination of experiences to the questions we are asking in this program. He practiced emergency medicine for 19 years before his own life experience led him towards chaplaincy and a deeper exploration of healing, meaning, and spirituality in medicine. He founded the Jewish Chaplaincy Services at Stanford Medicine, and he's developed award-winning work on spirituality, well-being, gratitude, and reflection. In the spirit of deep thinking and reflection, Dr. Feldstein will also stick around for a full hour after this talk. So I realize a lot of people will have to go, but if you are able to stick around for further conversation and questions, we'll have the terrific opportunity to really go deeper and reflect together. Oh, and there is Helen Morris. Hi, Helen. I'm so glad you made it. So without any further ado, let's all give a warm welcome to Dr. Bruce Feldstein for his talk, Making the Invisible Visible, Why Cultural Care Matters in Medicine. Thanks for being here.
Yeah. So Matt, why does cultural care matter in medicine? What is life? Hi, everybody. Welcome. You know when they say I'm delighted to be here? I really am. I really am. And to join with you. And I join with you in conversation. In conversation, I'll say more about that. So I don't see this like a lecture, more like a conversation. Now I'm going to be doing a lot or most of the talking, but I really am interested to engage with you. And whenever we're in conversation, there's always somebody speaking and somebody listening. And so I'll be speaking, you'll be listening. There'll be from time to time where I'll call and I might ask you to speak and I'll be listening. And I'm also going to be listening I'll be looking at all your faces. And I'll be listening through my seeing of your faces. I'll be listening. Listening, I'm seeing here is not just hearing, but I'll be listening, observing you, listening and interpreting. You know, I come from Detroit. I'll be feeling you, man, you know, to speak in that kind of way. Hey, I've got a handout for everybody. Did you get one? Oh, and could you please come sit over here so I could see you? Yeah, we got some nice choice seats up here in the orchestra section. Did everybody get a handout? Okay, make sure everybody has a handout, and you'll need something to write with. So, what do you notice about the handout? It's blank space. Yeah, that's intentional. So I'm not here, I'm going to be speaking, I'll be sharing some stories, we'll ask questions, we'll reflect together, again in conversation. And this is for you. This is to jot down as you listen to your own listening, to your own interpretation, to what jumps out for you, what pops out for you. Write it down. Write it down. And then when we get to the end of our time together, I'm going to say, so what's something you're taking away with you from our conversation today? And then I'll invite you to take a look at some of your notes. You know, jot down, you know, maybe what surprised you or what's touching you. Maybe there's something that's inspiring you. Maybe there's something you realize that you're grateful for. Maybe there's some new question coming up for you, even if you don't know the answer. So kind of jot that down as we go. And for those of you who, this is being Zoomed, right? Hello, Zoom audience. Take out a piece of paper wherever you are and jot down your notes. And then afterwards, and this is for everybody, on the bottom, curl up a little piece of this. Kind of like this. Curl up a little piece of this. This is interactive. Curl up a little piece of this, and then at the very end, I'm going to ask you to jot down just a couple of things that you're taking away. And then I'm going to invite you to tear it off and hand it in on your way out. It's anonymous. And then here's what I'd like to do. Then I'm going to take your takeaways, and I'm going to give them to Matt and to Lisa, and then we're going to collate those. And we're going to see as a group what we discover. So we're in the spirit of curiosity and group discovery here. That's the nature of this conversation. Okay. And it's my hope that when we come away, we're going to come away with, again, I'm going to use a metaphorical language, new eyes, new ways of seeing, understanding ourselves and each other. And as I stand here, I'm aware of something. Helen, Matt, I'm aware of gratitude. I've got a gratitude here. I mean, our topic's what is life? I'm aware, I'm just grateful for being alive, like really. Yeah, and I'm aware of not only being alive, but looking back on my life, just what sustained me and allowed me to come to this moment. And I'm grateful for that. So I want to share that with you. My home school, I'll go back. Hello, Stanford. I'm from Detroit originally, so you can place me. And I want to say in the spirit of the German Catholic philosopher, it is good that you exist. It is good that you exist. And really, I am glad that you are here. And me too. I'm glad that we exist and that we're here. And I'm also looking, what brings us all together? It's no small thing. People coming from look at the length of each of our lives that brought us to this moment. It's no small thing. And it's no small thing to be gathered together. What brought us together? In short, an invitation. An invitation. And each of us said yes to that invitation. And because of that yes, here we are, and something's happening. It's possible. And I want to acknowledge a special woman who I had dinner with last night. She's a national treasure, I discovered. And it's her vision and invitation, really, that makes us come together. And around her, we got mobilized. She entered into this medical school in the 1950s. And that was a time when only 5 women and 10 Jewish people were allowed to come into the medical school in a given year. And yesterday, she celebrated her 94th birthday. Happy birthday. So I offer my gratitude to you, Dr. Helen Morris, and also gratitude to life. I join with you today, as you mentioned, Matt, as a reflective practitioner and as a colleague. I'm your colleague. Do you know that? I'm your colleague. So what makes us colleagues? Well, clearly we're of different ages, different backgrounds, all that, but there's something that makes us colleagues. And for me, we've all said yes to something. It's a common yes. We said yes to the invitation. We said yes to, life, right? We're all here. And we also said yes to medicine, I'm imagining. How many people are involved in medicine in some way? Can I see hands? I don't see your hand. What's that? Oh, yeah? Used to be means that you're involved. It's in the past tense and it's still present. It's a living history in you. Can you deny? Yeah. Anybody else whose hand didn't go up? How many of us have ever been sick? Ill, injured, and you had to go to okay. So we're all in medicine, okay. And so let's join in conversation. And in the original spirit of conversation, from the Latin, con, together, versare, to turn or change. So together we come together, we change. And here's my little roadmap. We're going to enter into conversation. And in just a minute, I'm going to ask you to turn to a partner. I got something to do. We're going to pose the question, what is life? And what makes us human? And in that exploration, I'll talk about that in 3, 4, 5, 6. You'll see those numbers up there. And then I want to share stories, because this isn't just talking about, I want to share some from my lived experience, my stories, and how I came to see that. And then let's see what we discover, what's being made visible today, what we're learning, what we're discovering. Maybe it's a new question. Maybe it's something that's affirming about ourselves or our future. Okay? So, turn to a person next to you. This is going to be partners. So everybody has to have a partner. So odd people, if you're an odd person, put your hand up. Wait, turn to partner. Did everybody got a partner? Okay. Who's got a partner? You got a partner? You two? Okay, snuggle up there together. How about over here? You got a partner? You got a partner? Who's your partner? We need twos. Two's ideal. 1, 2, 1, 2, 1, 2, 1, 2, 1, 2, 1, 2, 1, 2, 1, 2, 1. You don't have a partner? Lady, yeah. How about you and the lady in green? Okay, you'll be partners. Okay, so turn to a partner, identify somebody who's an A. You'll go first, and somebody who's a B. Okay, you got that? We can do this, everybody, I know. Okay, now, here's what we do. Person A, let me share what we're going to do, and then I'll say, okay, let's begin. So person A will turn to person B. All the A's, raise your hand. Who's the A over here? A's, raise your hand. Okay. And then you turn to person B and you say, hello. So, who are you? Like we really mean it. You know, who are you? Hey, what prompted you to be here today? What's your interest? What are culture and care for you? And this is going to be real fast, so it's just top of mind. How do they show up in your life or your work? And why does that matter? And I know we're going to have a lot that we want to say. Whatever we say, let it be the tip of the iceberg, okay? And then person B, you just talk. And then person A, while you'll be listening generously, that means you're just listening for being with the other person. You're listening for whatever it is they have to say without judging it, without wanting to fix it, without wanting to cure it, okay? Just be with them, generous. And then after you're done, you each say to each other, thank you, you're welcome. And then thank you, you're welcome. And then we switch. Okay? Ready? A's? B's? Okay, begin. Thank you, you're welcome. I know this is the dangling conversation. I know you want to, I love it. I love the engagement here, okay? All right, now let's stop. Let's just take a little moment. Now switch, okay? Ready? Go. So now I have a question for each of you. If we could workshop this, we would. We could spend a whole day. It's rich. But let me ask each of you, so what did you discover? Was there something that surprised you that you didn't expect? Was there something that touched you in being together, or what you heard, or maybe about how you said and how you were listened to? Is there something that you're grateful for? Is there maybe a question coming up? Just think about that. And if you got a pencil or a pen, pick it up and jot down a couple of notes. I invite you to jot down a couple of notes. You don't have to. Okay. I want to say a little word about where I'm speaking from. My own path has included, what do they say, the long and winding journey, the road less traveled, we each have our own journey. Mine took me to music. I was music and science major, then to medicine and medical school, and then to medicine. I was an emergency medicine physician, you heard. Became very interested in healing along the way. Got introduced to philosophy and education along the way. Did a deep dive while I was doing my medicine into spirituality and religion, and I've experienced in a number of different religious traditions, including coming back to my own that I was born into, Judaism, but also many others, Christianity, Hinduism, Buddhism, different flavors, tree hugging, different stuff. And now into spirituality and religion in a professional way as a chaplain. When I tore 2 discs in my back and the spine surgeon said, Dr. Feldstein, the MRI shows you need to find a new work style and a career. What's next? Here I am. And it's beyond, I can tell a fuller story, I don't have the time, beyond what I could have imagined or dreamed. In fact, I knew I did not have the emotional fortitude to do this, and yet I discovered there was a meaning, a why, compelling me. So here I am. And along the way, there's a deeper inquiry, not only into spirituality and religion, but what it means to be human itself, from out of which spirituality and religion make sense and arise. So this has not been theoretical for me today. It comes from really my living these questions. Who am I? Why am I here? Why are we here? Where is my heart? What is my heart? And along the way, something emerged for me. It was really very simple. Let life. Let life. And when that emerged for me, it was during a very special kind of retreat time. It echoes for me with a Hebrew phrase that I grew up with. You've all heard the word l'chaim? L'chaim, who's heard that? Who's never heard that? Hands? You never heard that? I'm not just clearing my throat. This is Hebrew. Le, which means to, and chai, which means life. So l'chaim means to life. And you could think of that le like a preposition to life. But you could all, I'm so glad you're here. So I could explain this to you. I'm really explaining it to everybody. But l'chaim, to life. And that to in language is a preposition. It's a preposition, it's to, but it's a stand-in for me now for all the other prepositions. To life, for life. As a human being, I am in life, to life, for life, in life, of life, because of life, for the sake of life. You get the point? L'chaim, let life. And that brings us to our next question. So what is life? Funny thing happened to me on the way here. I was stopping to ask myself, so what is life? So I stopped and I said, do you all know who knows the movie Fiddler on the Roof? Well, if you haven't seen it, go see it sometime. The guy's talking to somebody up there, or something up there, or something out there, and it goes by many names. But whoever or whatever it is. So I'm on my way over here and I said, so what's life? And then a funny thing happened. I imagine whatever this life is answering back. So good question. So who's asking? And I said, who's asking? Me, I am. And life says, so good. So who are you? Who are you? And then I say to myself, now that's a good question. Who am I? Who are we? Why are we here? And then I stopped to notice, and I could take this into a long riff, but I stopped to notice, you know what? Who am I? Well, first of all, I'm aware. I'm aware of something. And this something I'm aware of, I exist, I'm here, I'm aware. And I belong inside, out of, to, with this, whatever it is. I'm aware, I belong, I exist. And I'm encountering this, whatever this is, and I'm in the world. I'm in the world. And it's happening over time, and I'm this body. So who am I? I'm this body, and it's a living body. I'm a living body. I'm embodied, and not just in the biology. Listen to me talking, I'm in language. I'm embodied in the biology and at the same time in the language, and I think about all the story that I am and all the story that we are, starting with our common evolutionary story, as well as our particular story. So I am in all of this, and I realize I'm not here forever. I'm finite, and I'm vulnerable in the meantime, and I'm not alone. Being biological means we are social, we are in relation with others. And I have a kind of mood, a sensibility about all of this. And you know what? It really matters. I care. And I care. And all this together is a kind of culture. This is my culture of being human, being aware and belonging and caring and existing and encountering and sensing and feeling and wondering and questioning. All of that is also a kind of culture. And then it strikes me. And so now it strikes me. Okay, so I'm back here. I'm done wondering over there. And I'm back here, and it strikes me what a remarkable thing it is to say, I am. I am aware. I am here. I am with you. I am. And then I think further, and again, from my history, my culture, you know, there's cultures within cultures. We belong to many cultures. And within the Jewish culture, these words carry an ancient response. It goes back to biblical times. And in the Bible, in the Hebrew Bible, there's a story. A guy named Moses. Y'all heard of Moses? Anybody not hear of Moses? So there's this guy named Moses. And he's walking along and he's talking, and he asks the Holy One, this life, what's life? He says, so what's your name? He says to the Holy One, he says to life, so what's your name? He wants to know. He said, you know, when you meet somebody, what's your name? What's your name? Okay, hello, Hineni. What's your name? Howie. Hello, Howie. Matt. You know, we all have names. Hineni, I'm with you. And so it's a funny name. It's a little inside story. And so he asks life. So what's your name? And you know what life says? You know what the response comes back? Some people call life, in this instance, God or Lord. You know, it goes by many names. The divine, the sacred, the one who can't be named, the you know what I'm talking about? Yeah. And so he asks, so what's your name? And the response is, I am that I am. So there's that I am. And I go, whoa. And I realized that I was just here saying, I am this, this, and this. So what is it about this I am? We're divine people. We belong to life. It's not the other way around. We belong to life. It's not life belongs to us. Life was here first, and then we showed up in the middle of it. And that's a romantic, wonderful story. And for some of us, it might be a struggling story too. So just to summarize, who's asking? Okay, next slide. Where'd Oliver go? We'll catch up with the slides. The thing seems to be stopped. So I want to stop and ask, what makes us human? Y'all see that? Okay. Moving one more. This is where the thing got stuck. You need to hit it again. Next slide. Okay. So what makes us human? So just to summarize some of the dimensions that I came to realize and over time. What makes us human? We're the kind of beings who are aware of our own beings. We're concerned with our own being. We're aware, we exist, we belong, we're in the world, we're in time. Living. We're living beings, embodied beings. Living, embodying beings who are biological, relational. We're in language, we're in history. And all of these elements are all true all at the same time. And we're vulnerable, we're interdependent, we're finite. We're in mood, always, care, culture. By the way, I'm going to make the slides available so you can think about this some more. And let me say something now about medicine. We're human beings in medicine. So what does being human and medicine have to do with each other? I mean, it sort of like begs a very obvious question. And what does that have to do with life? So for me, human beings, medicine, let me say it this way. Medicine is concerned with human beings caring for human beings for the sake of being human, for the sake of life, for the sake of living. So that's it. We're human beings caring for human beings. And medicine, you know, medicine teaches so much. Who's been to medical school? Who's in medical school? Who thought maybe someday you'd like to go to medical school, but then you said, oh no, let somebody else do that. I want to do something else. But anyway, so in medicine, medicine teaches many extraordinary, what I want to call ologies. So this is an intentional word, ologies. You know, like ology? I see some smile. You're getting where I'm going already? So what are the ologies, the studies of the different disciplines in medicine? So we study physiology, we study microbiology, we study immunology, and if you don't know what these are, it doesn't matter, just pay attention to the ology. We study cardiology and neurology and pulmonology and pathology, pharmacology, histology, epidemiology. We study this ology and that ology. We're filled with all these ologies, and most of them pertain to science, so we're studying all the science ologies, right? And then we go about, and this is understanding. This is what it means to understand the body, and it's a foundation for medicine. And wait, there's something missing. Where is the class on being human? Isn't medicine human beings caring for human beings? Where's the class on being human? I keep looking at you, Bill. What's your background? Are you in medicine? Where you went to medical school, did they have the class entitled Being Human? I already know the answer. No, and they still don't. And I'm at Stanford, and they still don't. And it's the one I'd like to teach. And where's the class on lived experience? Lived experience. These, for me, are the missing ologies. The class on being human and the class on lived experience. And you know what? There's actually fields and disciplines about that. And now I did a little bit of study in ethics. I was a visiting scholar at the Center for Biomedical Ethics at Stanford. We didn't study this either. We were studying the principles and the virtues and the applications. We were studying a variety of things. We used to talk about being human all the time, but we never really stopped to ask, what is it to be human? So that's called ontology. Boy, when I discovered that, I go, aha. And it's not something new. This goes back to the time of the Greeks. And the lived experience, this is called phenomenology. And as human beings, we're all in a first-person lived experience. First person, unique. Okay. Now, you saw that list. I'm giving a little bit of a little background, then I'm going to jump into some stories. So our list, these elements that I talked about, aware, belonging, caring, etc., these are what's called constitutive elements of being human. This is what makes us up. It's part and parcel of who we are. You take away any one of them, and you can't be human. If we're not aware, can't be human. If we're not biological, no human. If we're not in history, over time as beings in relationship with other, not human. You get my point? And it's all of these together. It's like water. Hydrogen and oxygen are constitutive of water. They come together and they form water. Something new happens in the coming together water. Take away any one of the elements, it's no longer water. So we're constitutive beings. We always belong. We're already always inside of life and predisposed to life. So to illustrate, time for some stories. Wait, while I'm taking a drink, any quick response, any question that's coming up? How is this landing for you right now? We got a thumbs up? Some perplexity in the room, like, I'm sort of following you, it sounds right, but I'm not quite sure yet. Some of that? Okay, yeah, this is the mood that we're in. Any quick question for me as we go on? We good? All right. This framework that I'm coming up with, for me, holds the potential to really change who we are as caregivers and what medicine's about, and also more broadly society. So let's get practical. So 3 stories, and in the story, in one, I'm an emergency physician. These are from my practice. 2 others, my role as a chaplain. And in this story, there's going to be different patients in a different room, the data, the evidence, all that'll be different. And yet there's something that becomes visible in each of these encounters. And that's what I want to orient us towards. It's the nature of every culture that it spotlights something that's of importance. And in medicine, the spotlight is on what? Our symptoms, the data, the evidence, the statistics, the efficiency, the science, right? But the spotlight matters deeply. But every spotlight also casts a shadow. What's not being spotlighted, and what's not being spotlighted in medicine. You know, we could call it out. Meaning, the emotion. The heart, not like a cardiac muscle, but like the heart, like an organ of vision, the soul, language itself. What matters? What matters? What's unspoken, waiting to be revealed? That's in the shadow. So as we're listening to some of these stories, listen for where the spotlight is, and then what happens in my encounter that shifted into the shadow and illuminated or shift the spotlight into the shadow. And in each one, what I've discovered is there's like a window that opens into a deep river of meaning or a flow or something more than just the science. It's something about life itself. So here's the first one. I'm in the emergency department. Oh, I've talked about culture. So we're in the emergency department. And a man in his 50s is brought in by ambulance. Charlie 1 to base, we're en route to your facility with a 55-year-old man. We're coming in from the tennis court. He's got acute left-sided chest pain. We've got an IV. He's sweaty. His heart rate is 120. And he arrives. Paramedics are transferring him. We're in the emergency room choreography, the culture, you know, the usual way of acting, reacting, and all of that, anticipating a possible heart attack. Okay, start a second large bore IV. We'll get some draw bloods for cardiac workup. We need a portable EKG, a portable chest X-ray, and EKG. And then usually at this time, that's what we call the chief complaint. It's the chest pain, and I'm responding to it. And then usually what happens is you walk up and there's a series of typical checklist questions. Where does it hurt? How long have you had it? Have you have, you know, this kind of thing. And it's in a realm, a point of view of science, of the evidence, of differential diagnosis, of treatment, all that clinical stuff. I see you smiling. Why are you smiling? What do you do here? Oh, I'm so glad you're here. I'm a 52nd year medical student. Yeah. You're a first year out of how many years here? And I'm a 52 out of. Okay, so here we are in the emergency department. So I walk up to the guy. Only this time, something happened that was unexpected. This time I went and I stood with him and I found myself just standing looking at him. Can you be my him? So I find, what's your name? Hi, guy. What's that? Oh, Sky. Hi, Sky. Okay, so I say to Mr. Sky, I say, hello, Mr. Sky, I'm Dr. Feldstein. I'm your emergency doctor, and I'm here taking care of you today. And I said it just like that. full stop came to this and was like that. And I reach over and I touch Mr. Sky's, or if it makes it more comfortable, his name was Mr. Frank. I touch Mr. Frank's arm, and he looks back at me, and then I say, I understand you came in by ambulance because of the pain. And this is usually where I go to my checklist, but I said something that was unexpected. I say, I understand what prompted you to call the ambulance, but what was it about this that prompted you to call the ambulance? And he stopped and he said, well, I was serving. He puts up his left hand, and I was serving, and suddenly I felt this really sharp pain, and it took my breath away, and I got scared. And then I thought about Uncle Joe, my Uncle Joe. And my Uncle Joe had, just before he died of a heart attack, he fell over dead. He had left-sided chest pain. And I said, well, are you afraid that, like Uncle Joe, you too are having a heart attack? And he said, yeah. I said, oh, okay. I said, well, let me tell you something at the outset. This pain that you're describing does not sound like heart attack pain. It sounds like musculoskeletal pain. It's painful, yes. Is it a heart attack? No. Your EKG is normal. But here, let's do this before I send you home. Let me ask you a few more questions. And as I'm talking to him, relief is just coming over him. The heart rate comes down to 80. The sweat on his brow goes away. Physiological changes. The whole thing literally took about this long, just about, several minutes. And I realized something. I realized what I was doing was no longer just addressing the chief complaint in the chief complaint cultural kind of way. I was addressing what matters most. For him, in his world, in his lived experience, I was addressing the chief, I began to call it the chief concern. And we began to talk about this in the 1990s, the chief concern. So what became visible? These kind of things that I was just talking about. And let me go back, the chief complaint in that cultural clinical way and all the science, this is important and this matters deeply, yes. And it's not the whole story. The whole story included the meaning and all of that. And then when I addressed that, when we made the invisible, the chief meaning and all that, we made it visible, then I addressed it, that became a new kind of medicine for me. Okay. Now, let's go into the coronary care unit. Come with me, I'm a chaplain. And I'm taking care of an elderly Russian-speaking Jewish woman. She has end-stage heart disease, and she's about to go on comfort care. And I'm at the bedside with her daughter. She comes from the country that's now Ukraine. Her attending doctor enters with the team, the fellow, the resident, the intern, the medical student, and they're placing her onto comfort care. And the daughter says to the attending doctor, my mother wants a feeding tube. And the doctor says, we don't do that. And she says, imploring, but it's important. It's important. And the doctor says, I'm sorry, it isn't safe. We don't do that. And I'm starting to get a little perturbed myself. And I'm seeing that the doctor's really holding on to protocol for whatever the reason. And the daughter leans towards me and whispers the following words. It's important. She survived Babi Yar. And in that instant, I immediately knew what was at stake and why it mattered. I'm going to come back to that. And the physicians now continue, well, the tube can cause, he explains, it can cause the stomach contents to go in. And he's explaining, the safety and the risk and why we don't provide it. And the daughter's getting distressed. The mother, who doesn't understand English, is getting distressed. And I'm getting distressed because she's not getting taken care of. And so I stood and I spoke to the doctor. I spoke to the attending and I said, "Doctor, please allow," I'm the chaplain. He doesn't know I'm also a physician. I can bring that out too if I need. But doctor, please let me explain why this is important. In fact, this is a matter of honoring this patient's autonomy. I use that word intentionally because we were coming up to an ethical standoff and he heard that word. He would recognize that I knew what I was talking about and he didn't want to go down that line. And I was prepared to advocate for this patient. And I explained, this woman is a survivor. She survived a horrific massacre during World War II by the Nazis at a ravine in the Ukraine outside of Kiev. And the ravine is called Babi Yar. And more than 100,000 Jews were lined up and shot and murdered there and shoved into that ravine and buried. There were rare survivors, including children. And she was one of those rare survivors. And she survived not only that murdering, but she also survived the intentional starvation. And she promised herself, and her daughter promised her that she would never die hungry. And that's why she wants the feeding tube. And the doctor said, "Well, let me think about it." And he walked out. And then a few minutes later, he walks back in and he says, "We will allow it." And then the elderly woman asks, "So what happened? What did he say?" She's speaking through the daughter. And I explained to her, I said, "Well, I told the doctor what you went through, your story about Babi Yar and why you don't want to die hungry. And he understands. And we honor your wish for the feeding tube." This is making the invisible visible. This is changing the spotlight to include the lived experience of this woman. I didn't know what it was going to be ahead of time, but I was already open for it and ready to listen and respond. This is good medicine. So what looked like a simple disagreement about protocol, when we start to examine more, becomes joining with her in her lived experience and being a human being, caring for what really matters most, including the history and the lived experience of this other human being. Okay. How we doing? Got another story. Ready? Thanks, Matt. That gives me the, we're in this together. So I'm in the early weeks of my chaplaincy training. By the way, that was a real encounter. I went from being the doctor who's at the top of his game and accomplished and knows stuff and can act and all of this. And now I'm a little baby chaplain. I'm about 3 weeks old. And chaplains are not treated like doctors anyways. And besides, I didn't know much. But I knew to find somebody who did know and to follow him, and that was Father Hester, the Catholic priest. So I said, "John, can I follow you?" And he says, "Yeah, come on with me." We're going up to the bedside. There's a woman in her 30s about to go for a double lung transplant. She's got pulmonary hypertension. I like when the chaplains have learned to talk doctor talk. I can relate to that. And there she is, and she's surrounded by her sisters, her mother. She's surrounded by her friends. And Father Hester stands at the foot of the bed. And he has this particular way of praying because he was coming up to offer a prayer before the surgery. But he does it this way. He gathers everybody around Nancy. And he says, tell Nancy who she is for you. You know what she means for you. You know what you're grateful about. Something you shared together. And if you had any regrets or something you want to forgive, now's a good time. Tell her about your love. Tell her what you hope for her. And then people started to do that, and people started to share the stories, and we're all standing around and we're holding hands because that's how they do it, or that's how he was doing it. And in that moment, I'm looking at Father Hester and tears are streaming down his cheek. And I'm starting to get horrified. Oh my God, the man is crying right here in front of everybody. How unprofessional. And because his hands are like this, he can't wipe them off, and so they're dripping down. But and then something extraordinary happened to me. I looked around the circle and I looked at the sisters and everybody looking at Father Hester, and you know what I saw? Their esteem for him was going up. And then I had my whole framework of what counts for professional was just like radically rearranged in that moment. And here he was standing like the rock of Gibraltar, the tears streaming. He's offering a prayer. Please be with Nancy, be with her, guide the doctors and the nurses in the surgery, that kind of a thing. Like, really. And I witnessed an emotional fortitude like I didn't know existed. To be able to stand like that in the face of that fire with the family in their experience in that very moment. This is good medicine too. And it's the kind of medicine that does not come in the IV. It doesn't come at the end of the scalpel. It doesn't come in the pill. It's not in the algorithm. It's in the being with. It's in the caring. It's making the invisible visible. So, if we had some time, which we don't, I would have you turn to your partner and say, so what's something you're coming away with from today's talk? What's becoming visible for you? So just think about it for yourself for a moment. We're kind of wrapping things up. Think about what prompted you to come here today. What was of interest for you? Think about what you've been listening to, and maybe you've been jotting a few notes, and take a look at that. Or just look inside, read your heart. So what are you coming away with? What's something for you? And jot a few notes down, and then on the bottom of your slip of paper, you know where you folded it up? Write some of this down. What are you taking away? Maybe it's, like I said at the beginning, maybe it's something that's affirming for you about who you are. Maybe affirming about your path and your journey, even though you don't know where it might be heading. Or maybe it's a new question for you. Or maybe it's, I don't know, maybe it's something I said and you wrote it down and because it's stimulating you and you want to think about it somewhere. So just write it down. What's something you're taking away? Well, let me go. Again, if we had a lot of time, we would workshop this. We would find out, this is groupthink. It's really interesting to listen to the listening of people, but we'll find out later. And I really hope you'll just put down whatever it is. Also, write down, what can I wish for you? What can I wish for you? Even if you have no idea how it might come to be, what can I wish for you? Put that down there. What can I wish for you? So for me, I'm coming away with gratitude. I started with gratitude, but it's like coming back around. It's a deeper gratitude even. I'm gratitude, for being here, for doing this work, for being able to share this, And there's one question that's been a really living question for me. And it's coming in an even more sharper focus. What is this alivening in me? What is this aliveness, this continuing aliveness that I am, that is yearning to be revealed and lived? That's what brings me here. I found this just to be so meaningful for me, and I want to share it with you. I want you to maybe invite you to ask yourself too. This is my question, but whatever are your questions? And in the wisdom of the poet Rilke, do you know Rainer Maria Rilke? Great poet. He talks about living with questions where we cannot yet have the answer. We're all so busy in our culture. Let's have the answer. And he says, be patient toward all that is unsolved in our heart. Don't try to answer the questions where the answers cannot yet be given us. And the important thing is to live the questions. So live the questions now, knowing that gradually, inshallah, knowing gradually we will live along someday into the answer. Someday into the answer. So, what do I wish for us? May we go forward with new eyes and notice and respond, not only at the bedside, but maybe in all our interactions with what matters most. May we cultivate an emotional fortitude to enter into the world. May we appreciate how spirituality, that is, matters of meaning, purpose, connectedness, and dignity, are also part and parcel of who we are. And may we appreciate and attend to that along with our science and our humanity. So as I asked, what can I wish for you? If I were with you one-on-one, and this is in the tradition of a 12th century Jewish physician named Moses Maimonides. Anybody heard of his name before? Let me say it. Who's not heard of Moses Maimonides? Oh, well, you just did. So Moses Maimonides was a physician, 12th century. And it's a funny kind of a physician who was a physician and a rabbi, a man of spirituality and a philosopher and an educator. So he's kind of a role model for me. And one of the things that he said in the course of his clinical work was, oh, and by the way, he lived in the most amazing time in Andalusia, in the area of Cordoba. And in that time, it was Muslims and Jews lived together side by side. And he learned from the Muslims. He learned what they had recovered from medicine from the time of the Greeks. And he integrated all that. And that became part of now of our culture and what led now to preventive health and other things. But he said, no visit is complete without a blessing. So not all of us use that language like blessing or prayer. So I say, what can I wish for you? It's a human thing. We all have wishes and hopes. So, and I ask you that. So, do you know what I wish for you? And I'm taking a look, and I really mean this for each of you, each in your own way. Whatever you wish for yourself is what I wish for you. Like, really, it's what I wish for you. Even if we can't put it all into words, and even if we don't know how it might come to be, I wish that for you. And I also want to say thank you.
I'm going to turn this on. The little piece of paper that Dr. Feldstein asked for you to fill out at the bottom, you'll tear it off and give it to me. We'll collate these answers and share them back with you, so you have a sense of what was happening in the room while you were here. Everybody online, thank you for joining us. We're going to just take a minute or two break, and we'll get into the Q&A.
Oh, and online folks, put it in the chat. What's your takeaway? What can I wish for you? Put it in the chat. Thank you. Do you want to hear something?
assume that others have some, but I have a list of questions for you, Bruce. So, okay, 1 second. It also helps if it's on. Turns out it works much better. Yeah. Um, so Bruce, what are some common misunderstandings that you have seen in terms of the role of religion, culture, spirituality in the healthcare arena by health professionals? What do you think are some oversimplifications or some misunderstandings that are common?
Well, there's a variety. Let me outline a couple of things, and then I can, as you know, my way of speaking can go wandering, so you help keep me on track. So the first is, it's got nothing to do with medicine in the first place. And that's been coming out of, that's not historically been the way, but in the 20th century with the advent of science, and then that became the way, and medicine was biomedical. Okay, let me say again. So for a lot of people, science or spirituality and religion, one group is, well, what's that got to do with medicine? We're in medicine. Medicine is about science. And they lost sight historically that medicine always included the spirit too, along with the emerging science. And so people will like not even, they will ignore me. Not so much anymore, in my role as a chaplain, or what chaplains do, or not be aware of this aspect of what's important for patients. And then people who are attuned to that, they'll think, oh, religion. You'll ask people, well, we used to, it's changed over time. Well, what do you think about religion? Like thumbs up, thumbs down? Religion, depending where you are now. In California, it's like, oh, religion. And again, so there's a lot of predisposition to having a negative reaction to it. And I understand that. And so then that influences the way people talk. And in medicine, the guy Freud, religion is the opiate of the masses, or whoever said that. That became a thought that, poisoned things. But religion, which I think about from where does religion come in our human being? We're standing there in the awe of life. I'm alive. Awe, what's going on? And that raises a question. Who am I? Where am I? This is a basis of religion. But we lost sight of that too. And then there's the spirituality, and people say, oh, spirituality, that's New Age, or that kind of thing. So that can be you know, some of the myths. But spirituality, which again is meaning, it's concerned with matters of meaning and purpose and our sense of connectedness. Connectedness meaning I connect to what matters. You and I are sitting here, we're in relationship with each other. There's a quality of connection. We belong to life, there's connection to that. There's elements of dignity. So spirituality becomes a kind of umbrella term for these core ideas. Not ideas, these core dimensions of living experience. And it's true for every single human being, each in our own way. Am I addressing the question?
Yeah, well, you're certainly hitting one of the things that I had thought about too in advance of this, which is this tension between concepts of faith, which sort of by definition are about things you believe without evidence, right? And science, which is all about numbers and evidence and making sure that, you know, what you do has, and it feels to me like in some ways you're exploring this gray space in between where there actually is some evidence, and you certainly there are anecdotes of beneficial health impacts from faith experiences, from human connection.
Yeah.
Right. So, yeah.
Oh, let me address this. So first about faith, I used to think about faith in much the same way you did. Faith is what I believed in, and then you have particular faiths. Like, what's your faith? You can say or not say.
Science.
Science, so that's your faith. And you ask somebody else, what's your faith? And they say, well, my faith, he said science. And then you say, well, what's your faith? And they say, oh, I'm Catholic, or I'm Jewish, or they want to give a religious label, or I'm Buddhist, or I'm Druid, or I'm Zoroastrian, or who are the other people I've met? I'm Wiccan, or combinations, I'm Hindu and Jewish, Hindu, or Buju, you know, so these are people who have different faiths because they think faith equals religion. Or faith, as you're saying, could also be like,
what do you believe in?
Like, what do you believe in?
Yeah.
And you've come to believe in science, right? Well, in my work, I've also learned that faith is something prior to all that. Faith can be worldview. The worldview, the lens that we already have, Heidegger uses the word thrownness. Every human being is thrown, predisposed to already having some understanding or of whatever it is, even if you've never experienced something before. We're already thrown to that. And that's our nature as human beings. We're thrown to that. And I think when I'm thinking about faith in this more ontological way, it's along these lines. There's something I'm already predisposed. And then inside of that, we can be predisposed to things that we want to believe about life or where our role is in it. But it's a predisposition to predisposition, something like that. But wait, I got one more thing.
Okay.
I would be glad to speak, and you can hold it up like right there.
Yes.
Yeah. Okay. So another is, can you hear me okay, Helen? Yeah. I had lunch yesterday with a researcher, computer science researcher that's studying computer science and at the interface of human experience. And she's interested in spiritual care and spirituality. And she's gone on to places like something called Caring Bridge and other sites like Reddit. And she looks at what people say, their actual language. It's a methodology of phenomenology. And then what she writes, that's what's most important, and she studied like 10,000 people and looked at the transcripts from it. And the thing that seems to matter most for people is prayer and meaning itself. And it used to be in integrative medicine. When integrative medicine was first getting going, they would say, well, what is alternative medicine? And prayer and spiritual practices were way up at the top of the list. Nowadays, they said, well, that can't be. So they chopped that off. Because for doctors, prayer and the spirituality was, if you ask them what matters most, it was like, even if put it on their list, it was down at the bottom. So what we're doing is it's part and parcel for me of being human. And what we're doing is I'm think of it like a historical repair job. That's our work. That's our work. That's what you're doing here. You're shifting the culture back to include the fullness of human culture. Okay. That's
Looking for raised hands, because if there aren't any, I'm just going to keep going. Okay.
Peter Hulak here. One of the things that I think all these points of view are suggesting is that listening is so important. And there are those who would say that listening is great science. And those who would say that listening is really a matter of person-to-person relationship. In the words of Henry Nouwen, it would be, I'm a guest in your life at the same time as I am a host in this hospital. So is it maybe a little artificial to say that they're different? That listening belongs in this field or that field. Good care isn't good care. Aren't we right in saying that good care is both? The good care is soul to soul, and good care is science with it.
It's a both and world, yes.
Yeah.
It's a both and world. And listening is foundational. It's part of being human, means we're in life together in language. Like here, you and I are talking, right? So I say something and you're listening. And listening isn't just hearing, it's taking in what I said, it's being processed in your brain, but then it's being processed in your imagination. It's said that language is a technology of language is a technology from one imagination to another. Guy named Daniel Dorr. And so here we are, I'm speaking, you're listening, you speak, I'm listening. And listening is the interpretation that you're making. It's not just an intellectual one, and it's a felt sense. You feel it in your body, and you're making sense of it through your memory, through your life experience, all your history. Those are all the filters, and that's happening all the time. And that's happening all the time. When Isaac Newton, what a great scientist, huh? And mathematician. It was during the Annus Mirabilis. It was during the year of the plague. He took himself outside of wherever he was in England, out to the countryside, and he spent in self-imposed isolation out there. And so he's sitting under the apple tree one day, and the apple tree falls. Not the apple tree, the apple falls. And he doesn't just see the apple fall, he listens. I mean, this is how I would say it now. He listens to the apple falling. And I don't mean like he hears it, he suddenly understands and interprets, and it comes new into him with an aha. That's listening too. And because he's a man of science, he was able to interpret. He says, oh, there's something going on here. And voila, we have gravity. So I think it's, can I tell you another story about this while we're on science and spirituality? I took care of a guy, his name was Mel. This is at Stanford. Mel was a physicist. And he's one of these guys who won some kind of important prize in physics. The kind of prize where only handfuls of people get the prize. And that means, and he was a Jewish guy, but not religious at all. And I walked in the room because he was sick, and he took a look at me and he says, oh, I want you to know I'm not religious. And I said, well, but he was Jewish. And so I said, am I in the right room? He said, oh, yeah. And he says, I'm a man of science. That was his real religion was science. And he says, you know, and I'm a physicist, and his way of science is to, and he says, you know, we talk in mathematics. And we talk a little bit, and then he says, can I tell you something? I said, yeah, so this is the moment of disclosure. He's going to share a secret that he's never told anybody. He says, you know, sometimes when I take the equations out as far as they go, and I'm imagining like him and this handful of people are the only ones who understand where he is in the universe of appreciating things. I take them out as far as they go. And then he looks up and he says, and I know there's more. And he gets this kind of look of awe. I know there's more. And then he says, and it's good. That's his experience. That's the hallmark of the spiritual experience. Now, he wouldn't call himself spiritual, but that was his experience. The mystic and Henry Nouwen, our friend Henry, don't you love all his stuff? And Henry Nouwen would say the same thing. And William James would say the same thing. But, you know, it is a human experience where you get to a certain edge and we're encountering mystery, which you can't describe. It's ineffable, it's not measurable, but that we experience it. And then his sense of it was, and it's good. That's mine too.
We have an exercise that we do with students each year, and I just want to bring this up because we had a good conversation about it last night, so I was hoping you'd share some of that
Oh yeah.
with the group about what is the proper response when you are with a patient who is experiencing, you know, existential suffering, and they ask if you would pray with them. And you're obviously a chaplain, so fine, that's what you're there for. But most of us are not chaplains. And I guess what would be your sort of criteria or the ways you would think about that question of, you know, doctor, would you pray with me?
Yeah. Well, first of all, you also said existential, which tells me it's somebody who's not using religious language. But then they say, would you pray with me? And that's what I find also very interesting, that, you know, there's no atheists in the foxholes. You know what I mean? You've heard that expression. There's no atheist people who don't believe in God in the foxholes of struggle okay, so would you pray with me? Well, have you been in that situation?
Oh yeah.
So how did you respond? First of all, what was your impulse? What was your reaction?
Here.
No, but this is.
I am comfortable
You
doing it occasionally.
You could pivot. So you're comfortable,
Cool.
and then what would you do? Because what I'm going to do is I'm going to ask a couple other people here, and we'll discover something.
Yeah.
I'm going to actually add something on because it's in the chat and I think this is relevant. So
Great.
while you're talking about it, also the difference between a chaplain crying in the room and a doctor crying in the room, which
the role morality, the role.
All right, let me just put that out of the way. I've been in a number of bedside, especially with some of the female physicians, oncologists who cry with their patients. See it all the time now. And there is it's about a love, a compassion. There's a sense of I am here with you. But let me tell you where the boundary is for me when somebody cries. If it's saying I am here with you, I'm with you, I'm not going anywhere, I'm standing in the fire with you, I care about you. And you, my patient, might put your head over here and you sob and I'm feeling it too. For me, ethically, fine. In fact, good. Now, if I start to cry, and whether I'm the doctor or the chaplain, and I start to go, oh. You get the point. Then it's all about me, and it interrupts the thing, and it's no longer about you, and you got to take care of me. Now that's not. So that's how I understand that's how I'm now drawing the boundary.
Yeah.
Okay, so now back to the prayer.
Yeah. So to the would you pray with me?
Yeah.
So as a clinician, not as a chaplain.
Yeah.
What are your sort of how do you think that through? I'm guessing that it's similar to the crying in that there are some parameters.
Yes.
So what are your parameters?
Yeah. So now parameters are individual parameters. And what you said was, well, I have some comfort around that. So that's one of the parameters. If you're not comfortable, then you don't do it. If you're not comfortable, you might say, I could see that's really important for you, prayer. Is that right? Well, I'd like to honor that. So let me find someone who can help, who can be here with you. So I can still take care of you, honor myself. So you see, it's what's the word in our ethics? It's integrity for both of us. So that's one aspect. What's that?
It also reminds me of the rest of clinical medicine.
Yeah.
Right? If someone asks me to do something that's outside my scope of practice, I find someone else who is capable of doing that. So in the same way I would refer to a nephrologist, I might bring in a chaplain.
It's the same thing, and it's about, am I comfortable, competent? Not only do I care to, but am I able to? And so in that sense, the ethics is similar. Somebody else might be very comfortable, and it might be, well, let's say you're both of the same, two people are of the same background. And then they're comfortable, and one's Christian and the other's Christian, and then they recognize each other, and they can do that, and they can say, yeah, Lord Jesus, be with us here, but that same person who's comfortable in that setting meets somebody who's not Christian, and they say, well, I'll be glad, I'm glad to be with you. I see prayer is important. And if you would lead the prayer, I would love to stand witness and be with you. And I'd like to share my own amen. So you can see we find a way. It's a design in the moment. It's a mutual design in a way that's taking care of you and also honoring me, where it's a mutual. I think it's a little bit like that.
Can I make a comment? Or
Please.
if a patient asks me to pray with them, prayer means different things to different people. And I really want to find out what it is they're looking for. And
Bingo.
my interpretation is generally, okay, traditional medicine, surgery, drugs, it's not doing it for me. What's left? And again, that's my interpretation. And what's left could be traditional prayer, or they may be asking for compassion, or just to hold their hand, or whatever. I don't get the sense that it is as straightforward as, well, do I provide a religious prayers with you? I want to know what it is that's bugging them.
I love your approach, and you're like teaching me what I teach others. So, yes, I see this is important for you. So what is prayer for you? Tell me what you're asking for. What would you like? Then I know whether I can provide it or not, right? Well, what is prayer? Oh, just, I don't know, whatever it is. Just what you said, and that's so lovely and caring in a human way.
I think the patient is asking for hope.
Yeah.
Give me some other avenue of hope.
Yeah.
And if you could provide it by sitting down with them and being human with them, and maybe relaying a personal experience that you've had where you were hopeless and then all of a sudden things worked out. Or maybe it is getting a rabbi or a chaplain or whatever. But I think the key is to find out what the patient's asking for. And I think it is our obligation as healers to find the answer to that question, as opposed to, that's not my job, I'm going to send you to somebody else.
When we train volunteers, human being volunteers to come in and provide spiritual care, and all doctors are human beings, all caregivers are human beings. So then we have the class, learning to pray. And, what is prayer? Learning to pray. And so the way it goes is exactly along the lines somebody says, well, would you pray with me? Well, what kind of prayer would you want? What are you looking for? And then the person says, oh, and then they say, may I, and they'll go and they'll say something from their heart. And it's said that the actual authentic words of our heart is the prayer. So when they drop down and they share with you really what's going on and what they're hoping for, and then you could say, I wish that for you too. It's like, what can I wish for you? Or we could just say amen to that or something like that. But that's like at the heart of prayer is what's our authentic hopes, wishes, yearnings, sufferings, something like that.
Yes.
Thanks, Matt. Matt knows these things, but there was nothing I appreciated more being here in that seeing this 83-year-old retired rural family physician was gratified to see the youth and the cultural diversity in this room. And I want to thank you all for making that possible, especially for young medical students. I was reared, I practiced in Ray, Colorado, 180 miles that way, 10 miles from Nebraska. There is nothing more important to rural medicine than a cultural understanding of your patients. And that's what enables us in the country to be close. We're friends with our patients. We see them all the time, daily. And so that cultural understanding enables the rural physician to be close and to understand what the patient needs, who they are, and so forth. I hope that some of these medical students who are in here are in the rural track. I really do. I was reared in a very conservative Christian household. The Church of the Brethren, very close to the Quaker philosophy. And in that church was the first place that I was challenged to ask, who am I? And it was in the youth group of that church. But my favorite course in college was, and it prepared me best of all of my college education to be a better physician, and that course was Religion and Science in Philosophic Perspective. I loved the course, and it taught me to ask the questions of my medical school professors. How do I best communicate with and understand my patients? Because I knew from the age of 5 that I wanted to be a country doctor. So what I would encourage. One more comment. Prayer with patients. I not only prayed with patients, I cried with patients at least weekly. And I felt I learned more about my patients in so doing than any other way, because I actually, from my course that I mentioned before, I developed my own theology. And it's nothing like the theology I was reared with. But what I did learn is listen to the patient. And prayer, I believe, is possibly the most introspective that a patient can be. So listening patients as they pray, I think, is an extremely valuable tool. And I believe that their cultural or religious or whatever orientation can be used as a tool, a medical tool that is just as effective as open heart surgery if you just listen to your patients, and they'll do it.
What's your name?
Jack Berry.
Jack. Bruce.
Bruce.
First of all, deep bow. Just a lot of admiration and appreciation. You remind me of one thing that I want to share with everyone, and then I have a question to learn with you. So the thing that I want to share is you exemplify how and that medicine is itself a spiritual practice. And there's other practices. Teaching can be that way for teachers. Law for people who are about the, championing justice can be that way. But for us in medicine, it's about living, it's a spiritual practice. Caring, it's a practice of love on behalf of our people, of what matters for you is what matters for me, and it's a spiritual practice. But so now you mentioned about the culture thing. So what is culture? In your view, you talked about how important it is, and I'm absolutely, so how are you understanding what is culture? As you think about some of your patients who've known, maybe it ranges something from knowing what spice they put in their apple pie to, I don't know. What is that for you, culture?
Some of my first patients, when I first went into practice, ancestors came from where we're sitting right now. I first practiced in a town called Okarche, Oklahoma, Arapaho, Cheyenne. Some of my first patients were American Indians in the Cheyenne and Arapaho tribes. Their culture, without understanding their way of life, culture, how they lived and what they valued, without understanding that, I could not be a good physician to my first patients.
So pause there, but so that's part of culture is the answer, or what allows us to see and answer who they are and what they value.
Yes.
That's a lens of culture. Keep going, please.
That's about all I got.
Okay, well, and plus what can't be put into words? How's that?
You sure?
Yeah.
What's invisible,
Yeah.
as you said?
Well, also, how about this over time? I could imagine, and my father was in general practice.
Yeah.
So that's not rural medicine, but that's general practice. And he had, generations of people, and I would go on house calls with them. This is in Detroit, and some of the people were from Hungary. Some of the people were from Poland, from Southern Appalachia, from all different kind of backgrounds, and we would move in and out. And he would know those folks, and he would know with the Muslim patients, and it's during the month of Ramadan, he would know that I'm not going to tell you to take this medicine 3 times a day, at 8, noon, and 6, because they're not eating then. But he knows that. Or he knows what people like, or he'll then ask, so say, how was the funeral? It's all this, the tapestry of their lives is all.
It's an understanding of what is important to those to people and what counts, what morally, what is.
It's about the what matters and what counts.
Yes.
There it is. Yeah. Okay. How is this for as you're thinking about cultural and influences?
Yeah, so
And what else do you want to talk about?
in the realm of sort of social science and measuring culture, right? The definitions of culture generally are things like culture is the way we do things around here, right? So that encompasses a lot, but so organizations can have a culture, and states can have a culture, nations can have a culture.
Exactly.
Religion, there's multiple cultural layers.
Professions, disciplines.
But they all are about sort of what counts as normal.
Yeah.
Or
and then
the
how do you
usual practice.
And everybody has something that's meaningful and counts.
Yeah. So I guess the question that comes naturally out of that, well, there's a couple. One is about the culture of medicine, and to what extent are we clear about what a culture means within our community, right? Because there certainly are ways of thinking and conceptualizations that are shared within medicine and maybe different from other communities. And then what do we do when there's a conflict, or even just a misunderstanding, or the lack of a shared culture, but you assume there's a shared culture.
Example?
Yeah. Oh, so the ones that we use all the time as the paradigms here are between, religious communities and medicine. So the Jehovah's Witness who declines a blood transfusion, right? That is contrary to the culture of medicine, very much in line with at least some components of this religious community. How do we navigate those conflicts? But I'm picturing this word, the way we're using the word now is much broader.
Yeah, I was intentional about taking it out of that kind of culture in medicine.
Classics.
Or 2 weeks ago in the New York Times magazine, it was all about culture. And you opened it up.
Like the annual culture issue.
Yeah, the annual culture issue. And so I said, oh, this is good. So what is culture? And I read it. So culture has divisions. There's food.
There's plays.
There's
movies,
there's entertainment, there's visual arts, and fashion, and opinion, and literature, and all that. That's culture. And then you could, name drop, or, oh, did you see the film?
Yes, because I'm cultured.
Yeah, you're cultured. And then it's how you talk about culture. Oh, you're cultured. Oh, you're cultured. Oh, you're cultured. It's a how and all that. And that's culture too.
Depends on which film.
Depends.
The film I saw this weekend does not make me cultured.
Okay.
How about culture as soul?
Culture is what? Soul?
Soul.
Yeah. Hey, speaking of soul, as human beings, we're, how do we introduce soul into medicine? So as human beings, we're born of stem cells, right? Stem cells, pluripotential, undifferentiated. Some guy asked me, he said, what's your religion? What kind of us, in my case, I'm Jewish. He said, what kind of Jew are you? And then I said, well, and I told him, I said, but before that, I'm something, before that, I'm a human being. I come from a stem cell. And then I thought about stem cells, and that becomes my eyes, my nose, my teeth, all the material stuff. But then I realized, wait, but I'm more than all that. But that's not stem cell. So I said, I'm also from a stem soul. Stem soul, that's the non-material, that pluripotential, it's all pregnant in there. And then it undifferentiates into the ways we hope and love and our gender and spiritualities and different religions and all of that derivative, stem soul. I don't know, you like that? Yeah.
Well, do we have some people online?
Yes, we have some people online. So this one question I'd like to start with because it relates to the previous two conversations. Where or how do you see cultural care practice being applied within spaces of care, particularly in instances where empathetic actions are frowned upon or act counter to institutional policies?
Can you say that one more time? And then if there's a particular person online who's asking this and you're still here, can you come on camera? Because I want to.
Yes.
That? Oh, okay. So could you say the question one more time?
I will repeat the question, yes. So this was from Youssef, who was on earlier. Where or how do you see cultural care practice being applied within the spaces of care, particularly in instances where empathetic actions are frowned upon or act counter to institutional policies? So counter to the culture of medicine.
I'd like to know more what he's talking about. Empathetic care is frowned upon?
Empathetic action. So I think like crying by the bedside, for example.
Oh. Well, you already have my opinion on that. There's things about our culture that interfere with, how do I say it? In my view, it interferes and stops the flow of living and life and vitality and well-being. If we can't allow for it. Now we have to, and there's ways to allow for whatever they're going to call empathy. Like touch is one. Now that's an important thing. Hugging is one. I don't frown upon touch, but I frown upon inappropriate touch. I don't frown upon hugging, but inappropriate hugging, I frown upon that, you know? So so I'd like to hear more about the situation, because they're asking a good question and it's something that bothers them. And I'd like to know, well, what's bothering you? And try and understand it more so that we could, you know, come to it. Maybe it was an example that something from their own lived experience, or somebody said, you know, you can't do that. I don't know. I don't know if I'm responding to, well, this is my response, and I don't know if it's how it's landing with, what was his name? Yusuf?
Yusuf, yeah.
Yusuf. So Yusuf, email me if you want to know more. We can talk more.
Press the button.
Trying to get used to this button down world here. In some ways, is it helpful to think that we're talking about a couple different kinds of dialogue? There's the dialogue between the patient and the professional, with these two souls in a relationship with each other. Isn't there also a dialogue between the forces that guide us? We all learned, you know, Hippocrates said, don't go hurting people. And we also trust beneficence to mean something. What if there's something we omitted that would have been helpful? So there's that dialogue, which we hope is a healthy one. Jack was mentioning the value of intimacy as he sees it in his rural world. Isn't there also a value of distance? Saying, right now I'm seeing someone who's in deep pain. I'm in deep pain too. Maybe I can, at the same time I'm feeling their pain, say, I need some distance with this in order to do the best work. What about, there's a dialogue too between, on one hand, saying, I hope that as a professional, I know my stuff. We always learn that we don't know as much as we think we do, but there's also another value there that says, I don't know their stuff, and I don't know their community's stuff. So I have something to say and something to hear. Isn't it helpful to recognize that as a tension that needs to be in dialogue? Or if you like the left brain, right brain figure, think of a corpus callosum is the place that allows this and this to sort of be in dialogue. They're distinct, but they're important values to be in dialogue with each other.
I want to comment on the corpus callosum. First time I came, I found myself with a woman in the emergency room. Mrs. Martinez was her name, and she had a metastatic cancer. It spread to the brain. I gave her the news that the CAT scan showed multiple metastases, and she was devastated. She turned to the side, her face grew pale. She said it was a death sentence, and I thought, how could I comfort her? And I couldn't, you know, reassure her medically, you know, that your doctor knows what to do, and I can't say, I know how you feel, and I can't say, well, you know, Mrs. Martinez, we all die sometime. Maybe Jack, with some of his patients over a long time, they've got that kind of doctor, you know, relationship. And then I see she's wearing a cross. And so I said, and she's from Mexico, twice my age. But I found myself compelled to say, well, are you a prayerful person? And she said, yes. And I said, well, would you like to have a prayer together? And I'd never done any of this before. And she said, yes. And so we had this prayer. And then afterward, I just knew it was right. After the prayer, the color fully came back to her face. Tears streamed. She said, like I'd never heard ever before, thank you, doctor, thank you. We're like from these two different worlds, but she's saying, thank you, doctor, thank you. And I just knew that was all right. I walk out of the room and I'm standing there And I thought, wow, I'm off my map, I'm out of my world. And I was living in a very left brain world. I was head of quality improvement and all that kind of checklist stuff. And we were doing all of that, and it was good, you know, and I'm teaching all that. But here I am acting in this very emotional, intuitive, spiritual thing was just coming through. And then somebody said to me, so Feldstein, what are you? Are you this left brain guy? You know, you this left brain, sequential, concrete, linear, all of that? Are you this right brain guy? Are you looking at the holistic of it and the spirituality and what you can't even put into words in the poet? And I look and I look and I realize this and this are both true. And then I realize, I'm standing on the corpus callosum. That's where I stand. I'm going to stand on the corpus callosum, and I'm on the interconnecting interstitial space. It's a both and kind of thing.
Okay, so I'm wondering how you foresee the future directions of this like compassionate and intentional caring as technology becomes more prevalent and as the younger generation uses technology as like a means of communicating, how you see the evolution of this like spiritual human connection that you've described. Because in some ways, like technology provides this cross-cultural communication and understanding that we haven't had historically. And in some ways, it puts a screen between people in a way that we haven't confronted in the past. So I'm curious how you see what you do in both practicing medicine and this more spiritual component, the like evolution within technology.
I'm going to end up turning the question back to you in just a minute. So technology is human. Human beings, part of what makes us human is we make tools. Tools allow us to express ourselves, to do things, to make things. So that's technology. Language is technology. It's a technology of the imagination that allows us to be able to communicate. So you and I are already in technology, but we think of technology as, you know, internet, and before that it was, you know, skyscrapers and putting people on the moon. And so we're in technology all the time, tools on behalf of who we are and what concerns us. And one of the things I know about language, and it's also true about technology, language reveals. Look what's made possible when I talk, but language also conceals at the same time. Technology can serve us, and it can connect us, and it can allow things. It can also distance us, and it could shine a spotlight on something that misses what really matters most. So similar kind of thing, right? Now I'm 72. You're not 72, you're a different generation. So you asked the question about the future, so then I can say, well, this is what being human looks like for me. And I would suspect that if we went back to talk to this guy Maimonides in the 12th century, or Avicenna, Muslim guy from Persia, or we went back and talked to Galen back in the time of Rome, we'd have these ideas about who we are as human beings. I think everybody would come to some consensus about it, you know, because that's our lived experience. So, and here you are, you're going to live into, are you a medical student? What are you? Where do you fit in all this? You're pre-med. Okay. Okay, great. So just a minute. So I'm an MS 52. Let's say you'll become a med student in 3 years. I don't know. So when you're in MS 55, the year will be 2080 or something. I don't know. So in 2080, maybe you'll be sitting here. And maybe you'll be answering and living into that question of this technology and stuff. And you'll be able to do it in a way that I can't, because I can't see that far, but you can. You can already start to see that far because you're there, I can't. So you know what? You and I, we're in this business together. Somebody spoke about ancestors. I'm your ancestor in this business. You're the future ancestor of somebody who's going to be sitting there. So I don't have the answer to your question, but it's a great question. It's the question of what's it the question of? It's the question of what is life and why we live. And then what are the tools that allow for this and facilitate it and further it? In what ways do we make tools that also take away from it and such? And then how do we design? I think one of the ethical duties is the duty to design. Not just, we have, what are the duties? There's duties. But I think we have a duty to design. It's to say, you know what? I got to take care of this world. I got to prepare for it. I got to bring it together. I got to take the tools that I got and make them work. And if they don't, I got to say so. And if we don't got the tools that work, well, let's make some. So it's something like that. Okay. So wait, you asked me a question. Ping pong, ping back to you. So I want to know, what's your reaction now to your question and my response? May I?
I mean, parts of it I think I agree with, and other parts I think that I'm in questioning of how artificial intelligence and other forms of technology fit into our like tool set as humanity, and whether or not they will just be used and utilized as a tool in the future, or if they will in some way take over or replace like human voice in medicine in particular, and not as like necessarily only a negative. Like, I mean, there's flip sides to everything, but it's just interesting to confront how communication could change so substantially in my lifetime, in your lifetime, and whoever the future is. But anyways.
I'm so glad you're asking that question and living it now. You know how I know you're living it? Because you're asking the question that matters for you. And it's a right, good, great question, and I'm appreciating you.
We're closing in on the end of the hour. Howard, do you want to have the last word?
I'm curious, you've identified a very important aspect of health care. And you're at Stanford at the medical school, and I'm wondering how successful you have been in getting this type of material into the medical education, and where it stands not only at your institution, but around the world.
Stanford is
30 seconds.
Stanford's a bastion of science and technology.
Got it.
Nobel Prizes in the science, and I've had those as my patients, and it's interesting too. Separately, after no one's in the room, then they'll talk to me about their spirituality. But this is we're on the margin. We use the word in the mission statement, care and such, but so we're on the margin, but it's alive and it's moving in, and so it's happening, and it's aspirational, a long way to go. How about you, where you sit here?
I'm in 52nd grade as well, and I asked the same question.
Let me just, I'm going to close because we have literally 30 seconds, but I want to close with a reflection back of something you said earlier, and it came across almost in passing, but really has stuck with me. And so early in your talk, you said that medicine is human beings caring for other human beings for the purpose of being human. And it made me think about something we talk about a lot in our program, and I think what you're raising too, Howard, which is how do we bring humanism into medicine? And I think what I took from that statement about human beings caring for other human beings
on behalf of being human,
yeah,
and on behalf of living. So that also extends it out to all living in life to which we belong.
So where I went with that was, I don't know that we need to bring humanism in medicine. We need to recognize that medicine is humanism.
We need to reveal the humanity and humanism that we already are.
Yeah.
It's not about bringing it in, it's about a revealing, making the invisible visible.
I don't know if that helps to answer your question, but it's a different way of thinking of it. It's already there. It is under-recognized.
Yeah, well,
All right.
well observed.
We will close with that and look forward to seeing you all hopefully at the next one of these.
Yeah. Yeah, well, that was good, huh? I thought so.